So, how's the little one?
He's good.
Yeah.
He's doing good. He has teeth that came out. I don't know if no, I don't. Yeah, this is kind of new.
Yeah.
So that's like 2 weeks in. So they're
Awesome.
just like popping on out.
Yep. So now he's biting everything,
Here you
chewing on
go.
everything. Yeah, those little
How's the family?
good. Yeah, they're hanging in. They are. Yeah, they're hanging in. We're all surviving. We're all surviving each other.
That's great.
Yeah. It's a again once again it's a weird year. It's not over yet. So,
It isn't. It's funny because it's like what in another week it'll be what October. I feel like the year is just it was slow, like in like the whole midst of the COVID. And now I feel like the year is just speeding on out, which is good because I think we're all done with
I
2020.
think we're done with this stuff. Yeah.
Yeah, so it can go. But hopefully 2021 isn't a repeat of this year. But this was like a horrible year,
Yeah.
to say the least.
Yeah. Um, yeah, that's it's been tough for us for all sorts of reasons. One of the things that I've read about recently is that one of the biggest challenges is that people are fairly certain that they've got this nailed down. That things like masks they help, they prevent spread, or at least they slow spread of COVID. Kind of slow this thing down until we can catch up and have a vaccine and what do they call it, herd immunity, trying to get to the herd immunity thing. Um,
Right,
but the problem now is that all of us, I mean all of us, we're sick of it. We're tired. We're just tired.
right,
We're tired of wearing masks everywhere we go. We're tired of not being able to see the people we want to see when we want to see them. We're tired of just making a decision to not see somebody, or if we do make a decision to go see somebody, feeling guilty for it,
right.
or going to a restaurant, or worried that if we do go to a restaurant, somebody's going to see us and they're going to judge us. It's just a lot. Everybody's
Well, that kind of goes to the man who is supposed to be running this country. Like, if certain things were done correct in the beginning, I think we would have been like how other countries are trying to deal with it. But people are able to continue going to work. People are able to go to restaurants and to be out. Like, everybody now in this country, everybody's just all over the place. It's too much politics in it. Where, oh, I don't want to wear a mask because my rights are being taken away. Not realizing you can kill somebody in your family or yourself. So it's just being hard headed. I want to do what I want to do mentality. And that's why we have numbers of 200,000 deaths. Hello.
right.
So, a hard head, as my mother used to say, makes a hard ass
Yep.
or a soft ass, one of the two. I forget. So, whatever.
Sorry, Yolanda's mama. We got it wrong. So, yeah. So again, we're tired of it. We're sick of it. And the problem is, of course, then when we get tired of it, when we give up and or we get into doing what we feel like we just want to do, then we run the risk of spreading it some more, and then it gets
Right.
out there. I think I hit here. We're closing in on, or maybe we've already exceeded 200,000 deaths due to COVID in this country. And I remember, I believe it was back in April, that there was a assumption that if everything went right, that we still are looking at about 60 to 70,000 deaths during 2020, and 2020 is not even over.
Exactly.
We're way past that, but that was also if everything went right. Everything didn't go right, and we didn't do this well. Well, one thing that I wanted to talk to you about a little bit about is something I've seen, or maybe some things I've seen on on a lot of the support group sites that I kind of stalk every once in a while. I don't actually make any comments on, but one of them that they kindly let me into that I actually shouldn't belong to, I guess, is the MGUS or Smoldering Myeloma support group. I don't have MGUS or Smoldering Myeloma, but they've let me come in there and talk to them every once in a while about stuff and about things that are going on. They'll ask questions about what's going on. And so, and I know we've been over this before, but MGUS is a monoclonal gammopathy of undetermined significance, which basically means that you've got the proteins, the abnormal M proteins or myeloma proteins in your blood, but essentially they're not doing damage yet. It's not shutting things down, or at least raised to that level of what they're going to go ahead and call multiple myeloma. And I think all of us, I'm assuming, actually I don't know the answer to this, but I'm assuming that all of us at some point as we're developing multiple myeloma started out in
Right.
right?
That's what I had. It started out, well, with my story. The oncologist that the hematologist, let's be specific, there's so many different variety of doctors. He said, oh, it's multiple myeloma. And then it was, after a second opinion, it's like, no, it's smoldering myeloma. So there is a difference, because that depends, do we treat or do we hold off? So that's like a huge, difference.
Because we don't know where it's at. And what I read, because MGUS, I believe, is sort of, I guess you would say, a level below smoldering, because then you would advance into smoldering. Is that right?
I believe so. I've always been confused by that, to be honest with you. It's like they're all in the basket of myeloma, but it's like there are differences. So I'm not really sure on MGUS.
Well, according to cancer.gov, that's basically the MGUS would be is if we know there's proteins there, but we can't determine that it's actually doing anything. And it doesn't look like it's advancing at all. Or at least it's not creating or increasing the plasma cells in the bone marrow. But smoldering myeloma, we know it's doing that, but it's not actually causing any. There's no other symptoms from the disease. So you're sort of in that level area. So that's sort of the pre-cancer, I guess, is what it is. Or I would say it's cancer. It's just not actually affecting you negatively. Yet. We know you have it, but so they'll very often, like you said, they'll watch it to make sure that they're not causing more harm than good by doing that. And so it seems to me that, and actually, you probably having trouble hearing me. Leave my microphone around here. I just realized my child actually spun my microphone around. There we go.
Yeah, I just put mine's closer as well.
There we go. So one of the things that I have observed is that there's almost, at least just from outward observation, it almost seems that in the smoldering and the MGUS community, there's almost more anxiety because you just don't know when you might be living there for years. And in MGUS, apparently, I think there's like a 1%, 1% of MGUS, those diagnosed with MGUS advance per year, 1%. And so, statistically, and I don't really know what that means as far as like numbers of people, but that means that what it also tells me is there are a lot of people that actually have MGUS or smoldering myeloma and have not been diagnosed. And so they're not being watched. And if that were known, and if we could identify those M proteins early, then that would be an issue. But anyways, what I was talking about, I wanted to talk about how anxious it feels to sort of live in that limbo, to not actually doing anything about it. Don't get me wrong, treating it's not exactly fun either. But at least you're at least in my head, I feel like I'm doing something when it's there. Like I know it's there. We know that it's causing some issues, and we're trying everything we can in order to push it back. And so for me, that's almost satisfying. Like okay, let's do this. Yep, this is going to suck. You're going to stick me with needles, and sometimes it's going to be inconvenient and uncomfortable, but we're doing something. But I can imagine that the not knowing, feeling like you're waiting to get out of prison kind of thing, but they just won't sign the papers. It's either tomorrow or it's 2 years from now. And that's kind of what I have a feeling that MGUS is like, what smoldering is like.
Right. Well, speaking for me, because I've kind of been through that with, for me, when I was properly diagnosed, which I say that to say, if things don't make sense, that's kind of where you seek a second opinion. If you're kind of weary of whatever it is that your doctor is telling you, just to ensure that you're going in the correct, direction that you need to go. So for me, I didn't start treatment until 5 years in. And that was based on another health matter that definitely brought my numbers kind of all haywire. And they were like, okay, now you got like 5 years. I still did labs,
right.
Even though you don't get treated, at least from my experience, I still did my labs, to see what was kind of going on. And everything was like stable until I had another health mishap where it was like, okay, we're going to go forward. So based on my experience, I was fine with not having to do the treatment.
Right.
I was like, ooh, 5 years in. Okay.
you got enough on your plate. Got it.
Like, okay, this thing of myeloma, this and smoldering that. It was like, okay, I don't have to do any chemo, because in my mind, I thought chemo as like the devil. Okay, it was like,
right.
But not realizing the different forms of chemo, like with the Velcade, with the shot in the stomach. Not that that was fun, but automatically you think of being hooked up to the IV, which, that did happen later with another drug. But for me, I can't say my anxiety was up. I was just like, I was feeling good that I didn't have to go through that ordeal.
It's interesting. Well, but you know what? You were already going through other things too.
Sure.
To be honest with you. Yeah.
Sure, but it's still that but in here.
I know.
Yeah. That's true. But.
Yeah. No, I know. I get it. I don't. Yeah, I don't envy you. I know that it's not fun either. So I mean, none of us is good stuff, and sometimes you just need a break after doing it for long. Because how long were you having to deal with your other health stuff?
That probably was a 3-year in, but then it kind of escalated as time went on. It was like, oh, okay, what's happening? Just like the whole body was just, okay, you're dealing with this myeloma, pre-myeloma.
Right.
And then, here's this other thing happening. I think it's kind of crazy, like when the body, all of these things affect the body. Even when they say, like if you're dealing with any type of cancer, how it can turn into other types of cancer or other type of illnesses that you may have, ailments that you may have to, go through with. So it's just interesting to see, okay, you kick one, but then you have something else to kick over here. So that's kind of like where I guess my dilemma was, if you will. It was like, okay, yeah, this other health thing happening over here. But now the myeloma, now we got to deal with that because now your numbers, this isn't good. And it's like, well, can't we just deal with this over here? So now I have two things to deal with. So, yeah.
Yeah, well, and anxiety is a very real thing. I was just actually looking at an article that says that statistically, people that have been diagnosed with, and again, this is a sort of this is a disease that often affects people that are in their mid-60s and older. The average age, and so you and I are outliers, being under 50 when we were diagnosed. Right. And so But apparently they have had several studies that have indicated that psychologically people are just as traumatized or affected by MGUS or smoldering myeloma as they are from full-blown symptomatic multiple myeloma.
Mm-hmm.
So, and I could see that. It's just the anxiety. It's the potentially sick things. Like I might be sick. I don't know. And it's the day to day. I guess is sort of anxiety feeling, which was interesting. I didn't really ever live in that phase because once I was diagnosed, I actually had full blown multiple myeloma. But there was about a month and a half there where I wasn't sure how significant it was, or as to because they didn't. You had to go through all the PET scans and everything to determine how much bone damage I had and so forth. And so it was which was weird to me because like I didn't feel like I had something. They're telling me I have something.
Exactly.
Yeah, they told me that I had this thing. Like, well, yeah, but the aches and pains that I have are normal aches and pains. I have those all the time. I didn't know that they weren't that they were separate, but I learned. But so I can only appreciate that anxiety for a very short period of time. But like I said, I can appreciate that sort of what if, waiting on something else to happen, the other shoe to drop. What else is out of control in my life? And so for me, control is very much a challenge that I've sought to overcome in my adult life. Is that I have to recognize that I don't have much, and that's what I've had to determine. So.
It's funny because I know some people who are in that waiting phase. They're in a smoldering or the MGUS, part of this disease. And, I agree, from some of the stories that I've heard, it is that anxiety where some may want to start treatment just to kind of get the ball rolling because it's been like a couple of years and so forth. But like I said, based on my experience, 5 years, I was fine as waiting. But I don't know. It's like, I guess it doesn't stand out if I had like a huge issue with the anxiety because in no way did I want this to escalate. I was fine with, okay, you don't have to act now. Okay, that's perfect. But then when, again, things kind of went haywire, that's when maybe my anxiety did go up. Like, oh, here we go,
Yeah. Well, what else do you want to talk about? How's the weather in Pennsylvania?
I have a couple of things, but first off, it's freezing. That's the reason I'm having this tea, green tea. It's like the weather just took such a dip. Like, 2 Saturdays ago, we went to New York. We had like an errand to run, and we visited like the grandma outside, like from a distance with a mask.
Right.
So it's just like a weird situation. Yeah. But while we were outside, it was like, oh my God, it's rather chilly out here. I think it was like in the 40s or 50s. We thought like maybe later it would warm up, and it's kind of been consistently cold. So I'm like, yeah, that's not good because that means we got to now turn the heat up.
Yeah. Yeah, it's been chilly.
It's chilly out there.
Yep. Although not probably what it is up there, but yeah, it's chilly. Of course, we're in the mountains, but still, I'd say it was upper 40s when I got up this morning. So
that's cold.
Yeah, that's cold. Yeah,
that's chilly.
Yeah, I wasn't moving real fast this morning, I have to admit. I was ready. I was sort of snuggling down a little bit.
Right.
And my neurotic old dog that has to pee 40 times a day had to get up 3 times in the middle of the night. And that's cold too. Like, dude.
How's he doing?
He's going down, but he doesn't seem to be in any pain, so he seems to be okay. So
okay.
Yeah. But thank you for asking. Yeah, I've got an old dog and these things happen, and I've never had one that had kidney issues before, which is what he has. But it's that's hard to watch. It's harder to watch my kids watch it because it breaks their hearts. So, and the youngest two have not had to lose a pet before. Carter has. Because we had two old animals when he was little, and we had a dog and a cat who were much older, and so he's gone through that. But again, it's been a long time, so
Right.
yeah, and so that's hard. In fact, actually, I texted him the other day when he's at college right now, and texted him and let him know that the what had happened with Dexter and the diagnosis and stuff, and so he apparently cried, and then his girlfriend started crying, and it's like this. So now I've apparently made South Georgia all sad because of Dexter. So
It's sad. I mean,
it is sad.
I think even so, when they have people disease, you know, I know when my grandmother died, she had breast cancer, and then a few months later, like our family dog, you know, it was like a beautiful German Shepherd.
Oh wow!
And he had cancer throughout his whole body. I forget the specific, but whatever it was, it spread throughout his whole body. So he went like a few months after her. So it's just like, how is this dog getting cancer?
Right.
You know, being young at the time, it's like you don't get it.
Right.
Plus, I don't think I really understood what this thing cancer is about until getting older. Like, oh, yeah, this isn't nice. So.
No. Yep, I know. So I've actually, I didn't even know this thing existed, but apparently there are hospices for animals, like hospice services. So apparently they can do things like just make the animals comfortable until, you know, whether it's long or short. You know, that's interesting.
That's interesting, but if that's the case, they could just be home.
Yeah, that's right. And they don't go anywhere. They come here. So hospice service would come to the house.
Oh,
so
okay.
They come to the house, and so they check to see if they're doing. So if they're shaking, they'll give them something for shaking, or if they're in pain, they'll give them something for the pain. So, anyways, yeah, I mean, and so I don't know. I know it's a decision that I'll have to make soon, and that's not fun making that sort of stuff.
Right.
I haven't done that many times in my life, but it's always heartbreaking too.
To go through that.
So what did you want to talk? You said you had something you want to talk about.
Yeah, so it was a few days ago, somebody in my social media read had posted something that I was like, oh, that's an interesting point. And it kind of leads to you being a little paranoid about it. So she's not the first. I may give her a shout out on a IG thing that we talked about this issue or whatever. But I'm finding that a lot of people are complaining that organizations or fake organizations or whatever they are in the myeloma community are using their photos. So they'll take their photos and say, let's say Kenny, you know, he's going through multiple myeloma, blah, 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 blah. And they'll use your picture on their feed.
Okay.
And then people are finding out however they find out, because I know I don't usually do a search like who's using my picture, because I don't want to find that somebody is using my photos. That would be a very bad thing for them. But in the world of social media, we do run that risk. So my point is, as advocates, you know, whether we're vocal or, you know, local and all of that, how do we protect our integrity when we have organizations, which we've heard on the news, where people run these, fundraisers for a particular cancer and then find out that that was a scam. So I just thought that was kind of interesting in terms of protecting our privacy And I know Instagram has things where you can report this, that, and the other, which I
Mhm.
have, because sometimes I'll get like these weird side DMs or whatever, and it'll be somebody naked. Okay. And then I'll block and then
Yeah.
I'll report. And I think the last time I did, Instagram came back and said, I guess they didn't see a problem with what it was because I think the person wasn't fully nude. So that's not acceptable. And what I have an issue with it, you don't have a phone number to call. This is all this kind of general reach out to the company to
So
kind of
so just to make sure, so you sure it wasn't like a fundraiser, like, nudity for cancer or something like
not
that?
even,
Naked for cancer.
not even,
Huh.
not even.
All right.
I was like,
Just one of
okay.
them. I'm
Or
just giving them the benefit of the doubt.
they'll tag you. They'll have whatever, then they'll tag like my myeloma chick. I don't know if they think that's like a porn name.
Ah,
So
that'd be
I'm like, no, baby, that's
that's
not
a
it.
weird fetish. Uh,
Okay, very, very much so.
I only like chicks with myeloma. Yeah. All right. That's a weird one, man. Like I'm into feet or something. I don't know.
Okay,
Yeah,
like,
but cancer? That's kind of odd. All right. Whatever.
oh,
Huh.
so
Hey,
I know
I'm a liberal guy. People have their things.
they have their things, like
Yeah.
it is
It's all
what
right,
it is.
but but you don't need the point is you don't need to use other people's likenesses in order to get there without their permission. Because I got to tell you, they got to pay you. That's all I'm saying.
Exactly. That's how, and I don't know if people realize that. It's like you got to be careful when you do certain pictures.
Yeah.
Like I know I posted with Chadwick Boseman
Husband?
when he passed away,
Mhm.
but that's kind of been out there. But then that's like you and me. Our photos have been out there. Somebody can use that same logic. Oh, let me just clip your picture to the thing. So you really have to be careful. And because social media is rather new in terms of what
Yeah.
you can and can't do, you
Yeah.
still have to be mindful that there are copyrights, there are licenses, there's certain things you have to
Sure.
use a little common sense when you do stuff. So what I saw, I just did a little digging for those who have questions or um, have a problem with this. They could probably reach out to there's a cyber civil rights organization and or initiative, and there's a helpline number. Maybe for those who someone's taking a picture or something pornographic or to that degree, they can
Right.
contact 844-878-2274. And that's the Cyber Civil Rights Initiative helpline. And
Right.
then again, I said Instagram, you can go to the help center, just read through all the crap that they have
Sure.
to report or block or whatever. Like I said, that's a little tricky because you don't have an email where you can just kind of like come at it as what you're trying to do. So that thing is kind of general. They will get back to you, but it's tricky. They use their own judgment as if it's a problem or not. So you may feel that it's a problem, but they may not, and they may keep whatever up there. And then the other is an organization called Without My Consent. And they just give practical advice as it relates to being on social media and people using your photo and so forth. Unfortunately, they don't have a number or email, so you just have to go to the site and just kind of, surf through the general stuff that they have.
That's actually one challenge I have with a lot of social media things anymore is how they have not, they don't make it easy for you to find solutions. It's really challenging. There's nobody immediate to talk to, number one. There's no phone number. There's most of them don't have any sort of chat thing. If you email or give them a hashtag, whatever, they usually just ignore it. So at least that's been my experience.
Yes,
And that's
I
hard.
agree. I agree. I know with my second book on myeloma.
Mm-hmm.
Wait, who's this? Oh, sorry, Kenny. Okay. Because I'm like 212. They'll go to voicemail. Um, I know, like on Amazon,
Mhm.
which is like a similar situation where, you know, you have people, they'll write their review. So, okay,
Right.
true. Not everybody has to like your product or whatever you're doing.
Right.
So there's one review on there where the person gives my book like a two or a three or something.
Right.
But then you read his comment
Mhm.
and he's talking about like gardening tools or something that has nothing to do with the book. So when I went out to
He
Amazon
hijacked it. Yeah.
to fight it, and again, it's like those general things where you click this link, you say what your grievance is, then somebody may get back to you. It's not like a direct communication. So I forget what the thing was, because I'm like try to fight it twice and then I'll get busy with life and kind of forget about it and just kind of leave it up there. But it's just, you can't get to someone directly about whatever your grievance is, you know, like,
Yep.
okay, well, this is a problem. And then they have like general people, maybe
Yep.
whenever they take a look at what that grievance is, they'll look at it, or maybe they'll take a month to get back to you and you'll probably forget about it.
Right.
So it's just like social media,
Mhm.
internet world, we just really just have to be careful how we kind of go in and out, because there are people doing bad stuff with, you know, our things.
Yep.
You know, and especially I think for us as advocates more so, you know, our life to some degree, some of it, not all, is kind of out there. So, you know, I
Yep.
just thought it was interesting with this lady within the community. She was like, she wanted that picture taken down, and you know, like I forget what the actually maybe I'll pull it up so that way people know to keep an eyeball on that. I think it was Myeloma Society, but let me check.
I don't even know them. I'm not familiar with Myeloma
Yeah,
Society.
there's a lot that I'm not familiar with as well, but yeah, I'll look at it while we're whatchamacallits. Because now I forget her name. Oh, here she go. Well, we could keep talking until I find it.
No, it's fine. So, yeah, well, yeah, there's a lot of that going on, and I've noticed that with the more I learn about social media, the more I'm finding people trying to collaborate. Like when we love your pictures.
Yes.
Let's collaborate. Look when.
What's
All right.
that about?
Like, man, I've had the same watch for 5 years, and there's a reason why. Because I like this watch, and I don't want another watch. I don't care about how fancy it is or whether it's made out of wood. So, in fact, making this out of wood would be probably a really bad idea. The way I treat watches. I'm not super fashionable. My office is in a shed right now. I haven't cut my hair since January, so it's just, I think you're picking the wrong guy. So I never get one from like, a shoe company going, hey man, we want you to wear our running shoes. I've never.
Right.
I have to work hard to get those things. I do them every once in a while, but man, I got to work for those. None of them ever said, we love your pictures. We want to send you free food. All right, cool. I'm down with that. I will endorse you if it's good. So yeah, hey, here's a 6-pack of beer. I love you. So I will be your man. But none of that. I'm getting, I get watches and hats. And they're not even like hats I would wear. They're usually like really, really pretty people, like gorgeous people that are like 25 years old. Look.
Right.
Yeah, I'm.
I think when it comes to, you really have to be careful, use good judgment. I've had people come out like with exercise thing, since, we're in that kind of realm of, of stuff that we do.
Right.
And it's like, there's always a catch too. Like, okay, we need you to buy so-and-so. And no, honey,
No.
I don't think so. Okay, it's not happening.
You got the
It's
wrong one.
Yeah.
You got the wrong one.
The wrong one. Before I forget, I found this, whatever it is. It says personal blog, but they're called the Multiple Myeloma Society. So I was right.
Okay.
And some people they have on there, I know, but do they realize that they're on there? That I don't know, and I'm not trying to dig up info on that. I looked through to make sure my picture was on it. That's what my concern was. Because when I saw her grievance, I was like, let me see who else is on here. So as long as I didn't see my picture and stuff, I'm like, okay. So yeah.
Well, my friend, I think we've got enough. I think we should talk about some more stuff next time. And then I'd like to put it out there. We've actually had a few downloads. We've had a really weird, soft year of trying to bring the myeloma team into being. And I think we're only on maybe 6 or 7 that we've really popped out this year. And so I think we could make this a regular conversation, and I'd like to.
Sounds good.
And so let's just sort of have a conversation, and let's do this again soon. You look at your schedule, I'll look at mine, and we'll start knocking this out. And I'd love to hear from people who have downloaded all 105 of you or whatever.
Yeah,
I'd like to hear some more. I'd like to hear what it is that you'd like to talk about when it comes to myeloma, because that is what we're about. I mean, I know that Yolanda and I complain a lot about politics and we talk about porn, but we'd like to hear what you want to hear. I mean, if you want to hear more about politics and porn, cool. But let's just let us know. Minus the porn. Okay, fine. We won't talk about the porn. But if you want to talk about politics, we're all in. We're complaining like the rest of you. So we're not happy either. And Yolanda, I think you and I are going to be part of a Janssen venture coming up soon too.
Change Maker Council.
Yeah, Change Maker Council
member.
Yeah, that's exciting.
That's exciting.
Is that in October? Is that?
They went out for dates, but
okay. Right, we haven't heard back yet.
Yeah, I may send a note, like, because it's supposed to start this week.
Probably should know that then.
Yeah, like, kind of want to know what date and time.
Yeah, that'd be good.
So I don't know what the delay is, but yeah.
Yep. Well, I'm going to put this out there now, and then Yolanda, you put out what you need to. But on a personal note, or semi-personal note, Throwing Bones, which is the organization that I am the executive director of, which encourages all blood cancer patients to stay healthy and active through treatment. We are actually coming up with our first true fundraiser of the year. Because of COVID, we've been shut down by just everything. So we're actually having a shakedown weekend, is what we're calling it, which is a bit of an homage to my Grateful Dead jam band root days. I am an old hippie. And so the shakedown weekend will start on October 8th, Thursday, October 8th. And we will, that night, if you live in the Asheville, North Carolina area, we have VIP tickets, because we will have a very socially distanced dinner and music event, as well as an online auction. And that will start at 5:30. I think it's going to 5:30 to, we say 8:39, but hey, look, if people are hanging and standing really far apart and not breathing on each other, and we're cool with that too. We'll have Moonfish 2 playing. We will have a good buddy of mine who will be moderating it, and we'll be talking about it. about what's going on and why we're doing it and the programs that we're supporting. The next day, actually at 9 a.m. in the morning, and Yolanda, I hope that you at least can register. It's a weird time on Friday morning, but we're having a exercise through as a part of cancer, and this is talking about purposeful movement. And in there, we're going to have Dr. Phil Chang from Cedars-Sinai out in Los Angeles attending. We're going to have Kathy Skinner, who is a cancer exercise specialist. She's out of Minnesota, Minneapolis area. We're going to have Carly Bailey, who is a physiologist at UNC Lineberger in Chapel Hill Cancer Institute. And potentially we're going to have another physical therapist, probably Dr. Sandra Capps, who will be attending also to again discuss all the things that you should be doing and why you should be doing these things in order to get yourself optimally healthy. And Kathy's going to show us a few things that you can do and you can do now safely, regardless of where you're at in your diagnosis and how far advanced you are in your cancer. And of course, there will be some concerns, and so we can talk about those. And it'll be open for discussion too, so that towards the end or the second half of the webinar on the 9th will be open for attendees. It'll be over a Zoom webinar. Can ask questions and experts will answer it, so we can have an open discussion. On Saturday, we are having our trail races, which is a 5K, 10K, and a fun run, which was originally scheduled for March 13th, which again got postponed. We're having it at the same location, but we also added virtual race to those components to those. So you can run it anywhere in the country. You just need to run it on that day, on October 10th. And anytime before 5 o'clock, record it, send a picture of it, and just upload the picture from your smartphone or whatever, as to what your time was and how you recorded it. You can either do that on your phone, or you can do it on, if you've got a watch that'll record that sort of stuff, then just send that in, and you get some really cool swag. It's a great t-shirt. This year it's a long sleeve thermal, and in case y'all do that, I would suggest probably ordering a size up than you normally do for a long sleeve shirt, because it is really snug fitting. And I've had a lot of feedback that people are not entirely sure that they want to show all their curves. So if you do want to show your curves, it's true to fit. If yeah, exactly. If not, you just let you know it's a little bit big. Personally, I size up. So no sense in showing off dad bod too much, man boobs and everything. So that's coming up. Check out throwing-bones.org if you want the details and how to sign up. They're Eventbrite and Ultra Sign Up are the two platforms that we're signing up through for those things. Also, if you want to watch the music, and I meant to say on the dinner on Thursday, if you cannot attend the dinner, you're not local, there actually is you can watch the show and attend the auction, the online auction. That is there, and it's free. I'm going to use air quotes because it's a donation only, but the donation can be as little as $1, and that's fine too. Same thing for the event for the webinar on Friday. It's free, but in order to get the access, you just have to put in $1,
Right.
And that's fine. And if that's what you want to give, $1 is awesome. That's great. Like I said, this is our first fundraiser of the year, and we're trying to support programs for our assessment video series, our Cancer Active Network, which is connecting patients or individuals with cancer and coaches, cancer certified coaches, as well as depending on how we do, it might just be covering some of the Throwing Bones administrative costs for the year, but we're hoping to also institute our Throwing Bones Patient Assistance Fund, which is something we had started planning on doing back in February. So it's just been a delayed year. Anyway, so that is that. Yolanda, anything else going on in your world that you want to share? I threw you on the spot. Sorry about that.
They are, but right now it's still in the works. So maybe the next call we can talk about that.
Awesome. Yep. So I'm excited. Next week, maybe we'll actually know more about what we're doing with Janssen Pharmaceuticals, and we can talk a little bit more about that if they will let us.
And we'll find out about that too. And anyways, have a great day, Yolanda. As always,
Thank
it's
you.
lovely seeing you and talking with you. You and I actually agree about so much, which is nice. And we like to complain about the exact same things. And yeah, so let's schedule a time. I'll talk to you soon.
Bye.
Bye.